We came up with the idea of the Eye Learn I.CARE program 3 years ago in May 2022 during COVID, when we received a 10 times oversubscription of preclinical medical students applying to the faculty's local summer attachment. We also took reference from the CUHK I.CARE program. Since then, it has become a very popular year-round extracurricular program, integrating clinical research, education by experiential learning, service by volunteering, and technological development in ophthalmology, which can be abbreviated to REST, REST. While each team member has his/her own unique roles, we support each other both vertically and horizontally. Our members are experienced not only in conducting eye examinations, investigations, educating on eye care, but also teaching these to students in clinical and outreach settings. Students, in return, also contribute by providing feedback during debriefing sessions. This engaging culture has been instrumental in our program development.
As our scheme is not part of the faculty's regular curriculum, but a voluntary of our program, we do face challenges including funding for staff equipment, recruiting volunteering ophthalmologists, coordinating students across institutions as well as subjects in the community and among different stakeholders. Over the past 3 years, we understand the importance of forward planning, engaging keen ophthalmologists, developing partnerships with NGOs and relevant professionals, as well as actively seeking research funding and donations. We also organize annual ceremonies to recognize the contributions of these parties and our students, as well as supporting them to present their works at the annual scientific meetings of Hong Kong Ophthalmological Symposium. One of our biggest challenges today is the loss of our founding member, my research nurse, Mr. Kan Pun, who passed away earlier this year due to a sudden illness. He has left a lasting legacy to our program and each of us.
Working as a team to promote education on different eye diseases, especially fluorine eye disease, dry eye disease, and non-COVID, has been exceptionally rewarding. Seeing the positive impact of our platform on patients and their families is truly fulfilling. We are empowering patients and their families for early detections and co-management of their chronic conditions. On the other hand, working with healthcare professionals from different fields have enriched our understandings and kept us up to date of disease management.
The most rewarding part, I would say, witnessing the growth and development of our student volunteers. Medical students, nursing students, students from allied health and other majors as ambassadors of our eye care. Students often hesitate about performing eye examinations or anxious in delivering eye care education to patients. But through training, workshops, and outreach activities, most develop confidence, knowledge, and skills, an important mission of our program, where we believe eye care could be taught and appreciated across disciplines and backgrounds. Last but not the least, students develop empathy towards patients, patients with each other, and leadership in driving our program further.
We are more than happy to share our experiences rather than giving advice. To establish collaborative educational initiatives, it is important to start with a clear vision and set objectives within an achievable time frame, while involving stakeholders and engaging participants early. We do encourage students to share ideas and feedback while celebrating periodic achievements along the way to keep members motivated. Keeping our passion for perfection and a committed core team are definitely crucial to us.
We're happy to share our experience instead of giving advice. Building collaborative education initiative based on existing interdisciplinary framework. For example, in clinical settings when ophthalmologists work with nurses, allied health including optometrists, eye care assistants, or in research projects when we collaborate with scientists and engineers, allow students to learn broadly and synergistically. A service learning approach allowing undergraduate students from different majors within and outside Faculty of Medicine and across universities to work hands-on and learn from each other will also be beneficial. They in turn provide peer supervision to high school student volunteers applying for bachelor's degrees. This ecosystem of learning and sharing is key to developing compassion and leaderships for our next generation of eye care professionals.